When a cancer diagnosis is delivered, the road ahead can feel overwhelming. Among the arsenal of modern medical treatments, one method stands out for its precision and long history of success: radiation therapy. Often called radiotherapy, it is a cornerstone of oncology, utilized in the treatment of approximately 60% of all cancer cases. But how exactly does it work? Is it the right choice for every patient? Today, on Scientific Research Videos, we're diving into the science behind radiation therapy, exploring the different types of treatment and weighing the critical pros and cons based on the latest clinical perspectives. At its core, radiation therapy uses high-energy waves, such as X-rays or protons, to target cancerous cells. The goal is simple but profound: to damage the DNA within the cancer cells. When their DNA is damaged beyond repair, these cells lose the ability to divide and grow. They eventually die, and the body naturally processes and removes them over time. One unique aspect of radiation is its lag effect. Unlike surgery, which removes a tumor instantly, radiation works gradually. Cancer cells continue to die for weeks or even months after the final session is complete. Even if a tumor isn't entirely eliminated, the radiation often slows its growth significantly. Most standard treatments involve 5 sessions a week, spanning 4 to 9 weeks, though new techniques are changing that timeline. One of the most significant advancements in the field is hypofractionated radiation therapy. Traditionally, small doses were given over a long period to protect healthy tissue. However, new research and better technology now allow oncologists to deliver higher doses of radiation in fewer sessions. This means a treatment that once took 8 weeks can now be completed in just 4. For patients, this translates to fewer appointments and lower costs without sacrificing safety or effectiveness. Currently, this method is most frequently used for breast, lung, and prostate cancers, providing a more efficient path to recovery for patients who qualify. Radiation therapy is incredibly versatile. It can be the primary treatment for early-stage cancers, or it can be used neoadjuvantly, meaning before surgery to shrink a tumor, or adjuvantly, which is after surgery to kill any microscopic cells left behind. There are 2 main delivery methods. External beam radiation is the most common, using a machine to aim beams from outside the body. This includes high-tech versions like intensity-modulated radiation therapy, or IMRT, which varies the intensity of the beam to match the shape of the tumor. There is also stereotactic radiosurgery, which delivers a massive, precise dose in just a few sessions. Then there is internal radiation, also known as brachytherapy. This involves placing radioactive seeds or pellets directly inside or near the tumor. This allows for a very high dose of radiation to be concentrated in a small area, sparing the surrounding healthy organs from exposure. The benefits of radiation are extensive. It is highly effective at killing the majority of cancer cells and can even reach isolated cells that a surgeon's scalpel might miss. One of the most significant advantages is organ preservation. For example, radiation can often treat breast or prostate cancer without the need for total organ removal, maintaining a much higher quality of life for the patient. Furthermore, the treatment itself is completely painless, similar to getting a standard X-ray. When combined with chemotherapy, radiation can create a synergistic effect, where the 2 treatments together are far more powerful than either one would be if used alone. However, no medical treatment is without its downsides. The primary challenge is that radiation can damage healthy tissue surrounding the tumor. This is what leads to side effects. The most common is fatigue, as the body uses immense energy to repair healthy cells. Patients may also experience skin changes, like a mild sunburn or peeling, at the treatment site. Depending on the location, other side effects can include nausea, dry mouth, or difficulty swallowing. It's also important to note that radiation is less effective in areas with poor blood supply, as oxygen is actually needed for the radiation to damage the cancer DNA effectively. Additionally, there are cumulative limits to how much radiation a specific area of the body can receive in a lifetime, meaning it might not be an option for recurring cancers in the same spot. Despite the potential side effects, the evolution of radiation therapy continues to offer hope and healing to millions. With increasing precision and shorter treatment times, it remains a vital tool in the fight against cancer. If you or a loved one are navigating a diagnosis, understanding these pros and cons is the first step in an informed conversation with your oncology team. Thank you for watching scientific research videos. If you found this breakdown of the latest medical research helpful, please hit the like button and subscribe for more deep dives into life-saving science. Stay informed, stay healthy, and we'll see you in the next video.